Hello guys, so today we shall be discussing regarding the ophthalmic branch. Okay, so what is this ophthalmic branch? Ophthalmic branch is one of the branch of the trigeminal nerve. So first of all of you know this thing, that trigeminal nerve. Trigeminal nerve is a fifth pair of cranial nerve. Okay, so this trigeminal nerve gives out three branches. Okay, for example, first of all, before I draw the trigeminal nerve, see, this trigeminal nerve has got a ganglia like this. Okay, so what is this ganglia? This ganglia over here is called as trigeminal ganglia. Okay, this trigeminal ganglia is giving out three branches. So the first branch which it gives here is called as a V1. Okay, next this is the second branch called as V2, and finally we have got the third branch that is called as V3. What is this V1 branch? V1 branch is called as a ophthalmic branch, or you can also call it as a ophthalmic nerve or ophthalmic branch. Next, V2 is called as a maxillary branch. After that, V3 is called as a mandibular branch. So V1, V2, V3, right? It is not officially classified like that, but this is something we kept it, okay, by ourselves, that for simplification purpose, V stands for fifth. Okay, so phi 1, phi 2, phi 3 also you can call it as, and by the way, this is your fifth pair of cranial nerve, right? And this one over here is your trigeminal ganglion. So now we shall be discussing about the ophthalmic branch. Now in the discussion of ophthalmic branch, first of all let me draw some pictures and then you will understand completely whatever I am trying to teach you. So here you have got a sinus called as cavernous sinus. Just side to it I will draw the eyeball, just side to it I will draw the nose also. So let us say that this particular sinus over here is called as your cavernous sinus. So this particular sinus over here is called as your cavernous sinus. Okay. Now important thing you need to know regarding this cavernous sinus is that just side to the cavernous sinus, what is the thing that I will draw? I told you, right? So that will be your orbit, bony orbit. So if you have watched my lecture previously on bony orbit, you will understand completely what I am trying to teach you. So this is your bony orbit. Now within this bony orbit, I told you have got supraorbital fissure. Let us say this part over here is your supraorbital fissure. Okay. Next, there is also infraorbital fissure, but it is not needed right now. Next important thing is that there is a foramen like this. So this foramen which I am drawing right now over here is called as a supraorbital foramen. Okay. So this is the foramen all the way here. So this foramen over here is called as supraorbital foramen. Okay. Next, after that, here you have got a ganglion here. This ganglion over here is called as a ciliary ganglion. Okay. And let us say this particular thing over here is your eyeball. This is your eyeball. Okay. This is your eyeball. Next, down to this ganglion over here. Here two important openings you have got. One is called as an anterior ethmoidal foramen. Another one is called as a posterior ethmoidal foramen. Anterior and posterior ethmoidal foramen. And down here you have got your nose. Now let us draw these branches over here. As I have already told you that the first branch V1 is called as a ophthalmic nerve, right? So this is the ophthalmic branch. So this ophthalmic branch comes all the way like this and it is passing along the lateral wall. You see, ophthalmic branch is coming all the way and it is passing along the lateral wall of the cavernous sinus. So the reason why I have drew this cavernous sinus in the form of a box is to tell you that this is the lateral wall. So this is your lateral wall of cavernous sinus. So along the lateral wall of cavernous sinus, you have got this particular what? This is your ophthalmic nerve. So this is your lateral wall of cavernous sinus. And this lateral wall of cavernous sinus, on the surface of this lateral wall of cavernous sinus, the ophthalmic branch divides into 3 branches. Now, let us discuss about each and every branch one by one. For example, it is dividing into this first branch over here. This first branch over here is called as your lacrimal nerve. Why it is called as lacrimal nerve? Because here you have got a gland like this. You see this gland, right? So this gland over here is called as your lacrimal gland. This gland over here is called as your lacrimal gland. Lacrimal gland. So this nerve that is coming all the way, you see, this is the branch that is coming all the way. It is passing through the superior orbital fissure, and by the way, this particular fissure which you can see over here is called as superior orbital fissure. Okay, so let me write this thing also over here, that this particular fissure which you can see here, this is called as superior orbital fissure. Next, this particular ganglia which you can see here is called as ciliary ganglion. Okay, ciliary ganglion. So through this superior orbital fissure, this nerve comes out and it supplies to your lacrimal gland in this way. Okay, so that is the reason why the name of the nerve is lacrimal nerve. The name of the nerve is lacrimal nerve. Now lacrimal nerve is done. The second branch, just look here. So you see this pink color nerve, this nerve is coming all the way down, and this nerve also passes through the supraorbital fissure and comes out. You see this particular nerve which I have drawn right now is called as frontal nerve. Okay, so this particular nerve which I have drawn right now is called as your frontal nerve. So this one would be your frontal. This is called as your frontal nerve. Now, this frontal nerve divides into 2 branches. So, one branch goes all the way inside and then comes out of this foramen. And by the way, the name of this opening is called as supraorbital foramen because it is above the orbit. So, this is called as supraorbital foramen. So, if a nerve is coming out of the supraorbital foramen, this nerve has to be called as supraorbital nerve. Supraorbital nerve. Okay, another nerve along with the supraorbital nerve which is coming out, this nerve is called as supratrochlear nerve. So this nerve over here is called as supratrochlear nerve. This nerve is supratrochlear nerve. So this is all about the frontal nerve. Now coming on to the largest nerve, right? So this largest nerve of this ophthalmic branch is this one. So this nerve also is passing all the way down, and it is also passing through what? It is also passing through the supraorbital foramen. And then if you see carefully, this nerve comes all the way down here, all the way down, and it directly gives one branch. What is the name of the branch? I will tell you later. But before that, one very important thing you need to know, that the name of this nerve is nasociliary nerve. Nasociliary nerve. Okay. So this nasociliary nerve gives first branch to your ciliary ganglion. Let us write this branch as A. Let us put this branch as A. Next, it gives its second branch to your eyeball. You see, it is giving its second branch all the way to your eyeball. Let us put it as B. Okay. Next, it is giving 3 and 4 branches. See, one branch here. It is giving another branch here. What are these 2 branches? Let us write it as C. Let us write it as D. C and D. And the last branch over here is as E. Okay. So what are these? So what are these branches over here? For example, branch number A. Branch number A is nothing but a communicating branch that is communicating with the ciliary ganglion. A is nothing but communicating branch. So nasociliary nerve has given one branch, That branch is communicating branch, and that communicating branch is where it is communicating with what? Ciliary ganglion. So it is nothing but communicating branch to ciliary ganglion. Now after this communicating branch, the second important branch over here. What is the second important branch? You see the branch number B. Branch number B is also called as long ciliary nerve. Long ciliary nerve. After that, branch number C, D and E. What is branch number C, D and E? Branch number C and branch number D are entering into some openings, some foramens, right? So these foramens are called as anterior ethmoidal foramen, posterior ethmoidal foramen. So the nerve that is passing through these foramens are also called as anterior ethmoidal nerve, posterior ethmoidal nerve. So the nerve here is anterior ethmoidal nerve. Next, D is posterior ethmoidal nerve. Posterior ethmoidal nerve. Right? Next, after that, it is giving one branch outside. What is that? That is E. What is E here? See, this one is supratrochlear, then E will be called as infratrochlear. Infratrochlear nerve. So E is called as your infratrochlear nerve. Now, what is the one thing that is happening is that you see what is D over here? D is your posterior ethmoidal nerve. Now, this posterior ethmoidal nerve, you see, it is coming all the way outside like this. You see, it is traveled all the way, and this posterior ethmoidal nerve is coming all the way out. Now, once this posterior ethmoidal nerve comes all the way out, it gives two branches. So, one branch is going up like this, and there is another branch that is coming all the way and entering into your nose. Okay. So, the branch that is going up here, this is called as a meningeal branch. This is called as your meningeal branch. And the branch that is going down over here, this is called as the external nasal branch. External nasal branch. Okay. So these are some of the most important branches of your ophthalmic branch. So these are the branches of ophthalmic branch. These are the branches of ophthalmic branch. So in the ophthalmic branch, what are the important things you need to know is that this ophthalmic nerve, right, this ophthalmic branch, it starts from ciliary ganglion, right. It passes first along the lateral wall of the cavernous sinus, and exactly above this branch you see two more branches. For example, you see one more nerve that passes through the lateral wall, that is called as cranial nerve number 3, and another nerve also passes, that is called as cranial nerve number 4. Right, just below to cranial nerve number 3 and 4, this ophthalmic branch is present. Now, it gives three branches. One branch over here, you see, one branch over here is called as your lacrimal branch, another branch over here is called as your frontal branch, and another branch over here is called as your nasociliary branch or nasociliary nerve. Lacrimal branch gives directly to the lacrimal gland. Next, frontal enters into the supraorbital foramen and gives supraorbital nerve. But before giving that, it will also give one more branch that is called a supratrochlear nerve. Next, coming to the nasociliary, nasociliary first gives branch A, that is called as a communicating branch to ciliary ganglion. Next, gives branch B called as a long ciliary nerve. C and D, that is anterior ethmoidal nerve, posterior ethmoidal nerve, and lastly E is nothing but the infratrochlear nerve. And this D branch gives two more branches. One is called as a meningeal branch, another one is called as a external nasal branch. Okay. So these are the branches that are given all the way by your what? By your ophthalmic branch. Okay. So thank you so much for watching my video. Goodbye.